Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A nurse is caring for a hospitalized 22-year-old female client with type 1 diabetes mellitus and toxic shock syndrome. Which of the following should the nurse perform first? 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. 2. Administer 50 milligrams of meperidine IM every 4 hours as needed for pain. 3. Teach the client to use pads at night instead of tampons during her menstrual period. 4. Administer 400 milligrams of ciprofloxacin IV every 12 hours infused over 1 hour. The correct answer is 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. Fluid losses can occur from vomiting, diarrhea, and fever and can lead to hypovolemic shock. The first nursing action is to treat the hypovolemic shock that accompanies toxic shock, so the IV fluids must be administered immediately. The fluid replacement is critical to avoid circulatory collapse. Pain medication and teaching can be implemented later. Antibiotics will be given because toxic shock syndrome is caused by a staphylococcal infection. However, fluid replacement is initiated first to treat life-threatening hypovolemic shock. A client taking oral contraceptives is placed on a 10-day course of antibiotics for an infection. Which of the following instructions should the nurse include in the teaching plan? 1. Use a barrier method of birth control for the rest of your cycle. 2. You should stop taking the oral contraceptives while taking the antibiotic. 3. Call your healthcare provider for increased hunger or fluid retention. 4. Take the antibiotics 2 hours after the oral contraceptive. The correct answer is 1. Use a barrier method of birth control for the rest of your cycle. Antibiotics may decrease the effectiveness of oral contraceptives. The client should be instructed to continue the contraceptives and use a barrier method as a backup method of birth control until the next menstrual cycle. The client should not stop taking her oral contraceptives, and there is no indication for or benefit to taking the antibiotic 2 hours after the contraceptive. There is no incidence of the adverse effects of increased hunger and fluid retention with the interaction of antibiotic therapy and oral contraceptives. A nurse is assessing a client with vaginal discharge. Which of the following diseases are commonly associated with vaginal discharge? Select all that apply. 1. Candidiasis. 2. Bacterial vaginosis. 3. Gonorrhea. 4. Trichomoniasis. 5. Syphilis. The correct answers are 1. Candidiasis, 2. Bacterial vaginosis, and 4. Trichomoniasis. Candidiasis causes a white discharge that results in redness and itching. Bacterial vaginosis causes a thick, white, adherent discharge. Trichomoniasis causes a diffuse yellow-green discharge and is a sexually transmitted infection. Gonorrhea and syphilis usually do not change vaginal discharge. A nurse is discussing daily activities with a client. Which of the following activities puts the client at risk for altering the normal pH of her vagina? 1. Consuming over 4 cups of coffee per day. 2. Having sexual intercourse during the menstrual cycle. 3. Douching unless instructed to do so by the healthcare provider. 4. Using tampons during the menstrual cycle. The correct answer is 3. Douching unless instructed to do so by the healthcare provider. Douching may disrupt the normal flora of the vaginal lactobacilli and change the pH, which could result in overgrowth of other bacteria. Coffee, intercourse during menses, and tampons are not related to changes in vaginal pH or the incidence of bacterial vaginosis. A nurse is planning care for a client who underwent a percutaneous needle biopsy of the kidney. What should the nurse plan to do immediately after the biopsy? Select all that apply. 1. Assess the biopsy site. 2. Take vital signs every hour. 3. Assess urine for hematuria. 4. Place the client in a prone position. 5. Assess the client for chest pain. The correct answers are 1. Assess the biopsy site. 3. Assess urine for hematuria. And 4. Place the client in a prone position. The nurse should assess the biopsy site for bleeding and hematoma formation. The client should remain prone for 8 to 24 hours after the biopsy. A pressure dressing will aid in blood coagulation. Vital signs assessment should be taken every 5 to 15 minutes for the first hour, and then less often if the client is stable. The urine does not need to be collected and kept on ice. The nurse should collect serial urine specimens to assess for hematuria. A renal biopsy does not put the client at increased risk for chest pain. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse evaluates the effectiveness of the client's post-operative plan of care. Which of the following would be an expected outcome for a client with an ileal conduit? 1. The client verbalizes the understanding that physical activity must be curtailed. 2. The client will place an aspirin in the drainage pouch to help control odor. 3. The client demonstrates how to catheterize the stoma. 4. The client will empty the drainage pouch frequently throughout the day. The correct answer is 4. The client will empty the drainage pouch frequently throughout the day. It is important that the client empty the drainage pouch throughout the day to decrease the risk of leakage. The client does not normally need to curtail physical activity. Aspirin should never be placed in a pouch because aspirin can irritate or ulcerate the stoma. The client does not catheterize an ileal conduit stoma. The nurse teaches the client with urinary diversion to attach the appliance to a standard urine collection bag at night. The most important reason for doing this is to prevent 1. Urine reflux into the stoma. 2. Appliance separation. 3. Urine leakage. 4. The need to restrict fluids. The correct answer is 1. Urine reflux into the stoma. The most important reason for attaching the appliance to a standard urine collection bag at night is to prevent urine reflux into the stoma and ureters, which can result in infection. Use of a standard collection bag also keeps the appliance from separating from the skin and helps prevent urine leakage from an overly full bag, but the primary purpose is to prevent reflux of urine. A client with urinary diversion should drink 2,000 to 3,000 milliliters of fluid each day. It would be inappropriate to suggest decreasing fluid intake. A client has an ileal conduit. Which of the following solutions will be useful to help control odor in the urine collecting bag after it has been cleaned? 1. Salt water. 2. Vinegar. 3. Ammonia. 4. Bleach. The correct answer is 2. Vinegar. A distilled vinegar solution acts as a good deodorizing agent after an appliance has been cleaned well with soap and water. If the client prefers, a commercial deodorizer may be used. Salt solution does not deodorize. Ammonia and bleaching agents may damage the appliance. The client with an ileal conduit will be using a reusable appliance at home. The nurse should teach the client to clean the appliance routinely with which product? 1. Baking soda. 2. Soap. 3. Hydrogen peroxide. 4. Alcohol. The correct answer is 2. Soap. A reusable appliance should be routinely cleaned with soap and water. When teaching the client to care for an ileal conduit, the nurse instructs the client to empty the appliance frequently. Which of the following indicates that the client is following instructions? 1. The skin around the stoma is red. 2. The urine is deep yellow. 3. There is no odor present. 4. The seal around the stoma is intact. The correct answer is 4. The seal around the stoma is intact. If the appliance becomes too full, it is likely to pull away from the skin completely or to leak urine onto the skin. Thus, if the seal is intact, the client is emptying the appliance regularly. The skin around the seal should not be red or irritated, which could indicate a leak. There will likely be an odor from the urine. Deep yellow urine indicates that the client should be increasing fluid intake. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.